So we're joined by 2018 Velma Jackson graduate and member of the Velma Jackson Hall of Fame, Myia Bacon. We thank you so much for finally getting on our platform as you're now a great labor and delivery nurse. We are in the health science career cluster. I've got a room full here with me at Velma Jackson. We're recording this for all of our friends in Madison County Schools, Rosa Scott, Ridgeland High School, Germantown High School, Madison Central, the Academic Options Center, my good friend Mary Slaughter over at Madison Career and Technical Center, and our YouTube channel. So thank you for finally being able to join us.
It's a pleasure. Thank you for having me.
All right, so before we get into what all you do as a nurse and some of the realities of the medical field, just give us a little background because, like we said, you graduated Velma Jackson 2018, involved in so many things here at Velma Jackson, TSA, basketball, volleyball, and I'm sure I've left a few things out there. So tell us about your Velma Jackson experience and how that prepared you to go to Southern Miss.
Um, my Vilma Jackson experience, I enrolled in a lot of dual enrollment courses before I graduated to help me get further along in my degree plan. And then whenever I left school, I ended up with 28 dual enrollment credits before I was a freshman.
Wow.
So I was technically considered a sophomore whenever I was a freshman in college. I got enrolled at USM. I did the programs. You do 2 years of your prerequisites at any school of your choosing. And then I applied to nursing school there. And then I didn't get accepted, but I applied to UMC so I can move back home with my mom. And I got accepted. I just say be mindful of whatever school you choose to go into your prerequisites because some of the classes that you apply to will not transfer over. So depending on what program you want to go to in the long run, just overview and look over their degree plan to see if it aligns with everything else that they need.
Yeah, and that would be no matter what program you choose. So that would even be at the community colleges. That would be anything out of state. So very important, no matter what major you have, because I know we have more and more going the community college route. Be mindful of that and get with the counselors to make sure everything's going to align there. Now,
Yeah.
uh, once you became a nurse, tell us, well, first of all, tell us about nursing school because we have a couple of young ladies in here that want to be nurses, and I know it's a very popular career choice among our community, as it should be because we need more nurses. But I think it's important for people to understand once you even start nursing school, doing the clinicals, you're going to have to touch people, you're going to have to move people, you're going to have to smell things, you're going to have to see things, you're going to have to unfortunately sometimes see dead bodies. You're going to have to see blood. You're going to have to see feces. So there's a lot of things that I think isn't on the glamorous side because we see the TikToks with the stethoscopes and the scrubs and think
Yeah.
it's just some glamorous job. So talk about the realities of what you actually have to learn going through a nursing program.
So going through a nursing program, I understand most people sometimes they can get by with just not studying or going to class. That's not the reality of it. You will actually have to use your critical thinking. You will have to learn how to adapt. Whenever you go in, they're going to introduce you to everything. They're going to give you a full list of your syllabus. Whenever you start sure everything, you're still learning. You're still having trying to figure out what works best for you and what study methods works best for you. But whenever you start, I can say I am grateful to UMC's nursing program because it's more of a hands-on learning experience. So whenever you go to clinicals, you're actually able to go with the nurses, pass meds, meet the patients. And yes, it is a very um you will be able to interact with the patients. So you can't be afraid to just I guess more so get your hands dirty. But there are always different avenues for nursing. You don't just have to be at the hospital if you don't want to, but you have to be willing to stay focused and just do what you have to do because at the end of the day it's between you studying and you have to actually pass those classes each semester because if you don't pass a semester then you will just have to stay and make up the semester again if you do not pass. But there's plenty of opportunities. You can always go talk to your teachers and ask them, hey, I'm kind of struggling with this. Can you explain this more? There's always study groups. There's plenty of people in the class that you can get with to help you study.
Yeah, and something that's interesting about nursing is because I spend this platform all the time talking about we need more women in XYZ field. We need more women to do this. But in nursing, we need more men. Every nurse I talk to always tells me if we just had one more guy on our floor, it would be so much easier. And people don't think about this. And honestly, until one of my friends that's a nurse told me this, I never thought about it. They said sometimes we need a guy is strong enough to move somebody. Sometimes we need a guy that can reach something in an emergency situation. Sometimes a patient is really embarrassed about what happened and they'd rather talk to a guy. So talk about, there's a big need for men to get into nursing.
Yes, there is a big need for men to get into nursing. I haven't, well, we actually have male providers that's on our unit now, so that's a great help. I actually like seeing the men come on the floor because they get to actually see and experience and see what the women are going through. And as far as men, there are a lot of avenues that you can actually help the nurses. Like sometimes we'll have, if say if a patient's on bed rest, we have to turn them at least every 2 hours. There are a lot of skills that you can actually learn and get involved in as far as like in the nursing program. There's like a lot of different things that you can do actually. And it just depends on what career choice or what path you want to do. You can either do med surge, ICU, cardiovascular, respiratory, wound care, burn unit. There are like so many different options for you to choose from.
Yeah, and I'm glad you mentioned that too. We're about to get into labor and delivery, which is I know where you are. But talk about some of these other careers that you work with because people just think it's only doctors and nurses. There's a plethora of very skilled individuals in a hospital or a clinic setting that don't necessarily have the RN. You're dealing with, patient care. When I was in the hospital a couple of years ago with my emergency situation, I had a nutritionist come by and talk about if I had any food allergies because when people are in the hospital they got to eat. So nutritionists are very important. You mentioned respiratory. During COVID, we saw the need for respiratory therapists. There is a big need for
Yes, we do.
physical therapy assistants for people coming out of surgery. There is a big need for you got to have good CNAs as far as patient care. You've got to have good techs. You've got to have good
Yeah.
technology people. All this equipment that is there, you got to have people to operate it. So talk about some of the other avenues in healthcare and I forgot. When I was getting an IV, somebody had to be in the pharmacy to fill the IV bag. So talk about some of these other careers that maybe people don't really think about but are really needed.
So what we call it is like an interdisciplinary team. That's when you can have pharmacy, doctors, it's everybody. So we always work. We have housekeeping on our specific unit that helps us. We have housekeeping. Sometimes depending on what the patient's condition presents, we can have dermatology if they have any skin breakdown. We can have wound consult, like you said, nutrition. We have what did we have last time? We had a lot of people come on the unit to help with the patient. We did also have PT come and help the patients because sometimes it's a lot of different patients come in. Sometimes if they don't have movement in either of their extremities, we always have extra people come in to help them with that as well. So it's not a day that I don't learn anything new from somebody else because you learn something new every day.
Yeah, and there's a big need now. I know UMC, it made the news, a cyber attack. You've got to have good IT people. So if we have people that are into the computers, want to get tech, the IT people at the hospital are just as important as the care because you're talking about records, you're talking about charting, you're talking about payments. If somebody is in need of meds and the system goes down, you don't know what they need. So the IT tech people are extremely important in a hospital clinic setting.
Yes, yes, they are. They're truly essential. Sometimes we will always help. Say if we had an error with the computer, our badges are not working, or something's wrong with the Omnicell that we use every day to let us get medicines to give them to our patients. They're very essential to the hospital.
Big time. Now, you're in labor and delivery, and our family consumer science classes are getting some of this too because they're talking about childbirth. And it is, we see it on TV, we see it in the movies, and we all know that it is very dramatized. But there is a lot of things that have to happen once somebody or a woman goes into labor and is getting ready to have a child. And obviously, you need great people in care, but talk about how that process works and how healthcare professionals like yourself are playing such a big role in making sure that birth or her labor and then her birth and recovery are going as smooth as possible.
So I can say, as being a labor and delivery nurse, it is a great experience because you're able to be there, be the support, be the advocate, and also be there with the patient so they are actually heard and cared for. So whenever they come in, we're able to help them with their induction. We're able to assess fetal heart tones, help the mom, and we're able to see like new life being born and be there for them and make sure that they're cared for. Because the main thing with new moms or moms that are having multiple children is that they want to be heard. They want to make sure that, okay, I can trust you that you're going to be here for me and advocate for me. That's the main thing. And with the experience, sometimes not everything goes how we want them to, not everything goes as planned, but you being a nurse or her nurse, it just shows to say, okay, I'm here for you. I can always adapt to whatever, however the situation presents itself. You have to be able to adapt, think critically, and be there for your patient.
Yeah, and you have to know whether, and again, this goes back to all these other professionals. You have to know whether or not this woman can take a certain type of drug. You have to know if she's going to bleed. You have to know if there's any complications with the fetus before it comes out. So, what are some things you have to know before she ever gets on that table ready to have that child?
So that's why before they come, before we do anything, we it's always the nurse that will be one-on-one with the patient. We can get to know their background, get to know their preferences. Sometimes they'll have like a birth plan, and they will let us know, okay, I want this for delivery, I want these vaccines, and we'll just go through everything regarding they want skin to skin with baby, do they want baby to be cleaned off, and we just go through everything. Like, how are you feeling? Do you have any complications? Like, go over medical history because that's the main thing. That's the only way you'll be able to know what is wrong with your patient if anything were to present, and how you can address it, because you have to know the patient's history. You have to go over their allergies. You have to go over everything.
Yeah, and then on top of that, unfortunately, there's times where emergency situations happen in pregnancies, and not only do you
Yes.
have to be trained in the delivery of the child, you have to be trained in life-saving techniques because, yeah, you're going to call a code team, but right there, that person's life or that newborn's life is depending on your medical training in order to save them. So, talk about what could
Yeah.
happen in those type of situations.
So any medical emergencies, it regarding if I'm calling a code, or sometimes we'll have a situation where there is an IUFD, which means that there's a fetal demise, meaning the baby's no longer alive with us. So you'll have to be able to go from thinking critically and learning how to adapt in a very serious emergent situation to, okay, they just lost a child. I have to be there for them and know how to advocate for them so they able to adapt. In emergent situations, we have situations where somebody can go into help. That just means that's more so with the liver. They can also have a bleeding risk. They have hemorrhages. They have cord prolapse, which just means sometimes if the water is broken or the patient's breaks itself, the baby's umbilical cord sometimes come in front of it. That's a more so emergent situation. And if sometimes whenever we're trained, I'm learning to do cervical exams as well as the doctors. So
Wow.
I can come in and say, "Hi, my name is Myia. You always ask the patient, is it okay first for you before you touch them? You just don't want to go in and just touch anybody without their permission. And then if they give you permission, you're able to actually check their cervix and see how your baby is progressing. At any time I feel anything, like I said, a cord, okay, I will have to call, like ask the dad sometimes or the family member that's present at bedside. Please press the call like for me and tell them I have a cord. And at that point, I have to leave my hand in their vaginal canal and I have to ride the bed all the way to the OR and keep it there until the baby's delivered. Because at that point, the baby's head is pressing on the umbilical cord and it's kind of like stopping their oxygen, so they're not breathing as well. So you learn to adapt.
Yeah, and again, it's like we mentioned, because a lot of young people are interested in health science, and it's important to know you're gonna get blood on you. You're gonna have to put your hands in people's
Yeah.
bodies You can't say, "Oh, this is gross." I mean, you got a life at stake here, and it really is. I mean, again, it's an important job, but it's important to know the seriousness of it at the same time. Now, we were just talking before you came on, and I talked about why it's so important. If you are bilingual at all, if you can sign, if you know Spanish, there is a huge need for you in the medical field, and we have a lot of first generation Americans in our district, a lot of immigrants, and it
Yes.
is so important if they are at all feeling the need to get into this field, they are needed because, like I was telling them about my father, who's a doctor, he's learned a lot of Spanish to deal with patients because he said, "I don't have time to wait for an interpreter if somebody's life is at stake." So, for those that are bilingual, no matter what language that is, there's a huge need for them here.
Yes, it's greatly appreciated. We have a lot of people that surround the hospital as far as them coming from. Sometimes like, we have a lady, she's within research in our department, and she'll sometimes like come collect the placenta if it's like needed, like moms have gestational diabetes, hypertension, or anything else going on. She'll come collect, but she also speaks English and Spanish, so she's able to communicate with the patients, and it's great if you're able to communicate with them as well. The patients more so really light up when they find out, oh, you can speak. And sometimes we're able to introduce ourselves, but that's it. That's as far as we go. But the hospital does provide us with a stratus, and with the stratus, it's like on the phone and able to pull up any language, and they'll connect us with that person. Or if we're not able to use that and our Wi-Fi is down, we also have a number. It's provided to each nurse on the unit, and it's called like language line. And we're also able to call them and get them on the phone to communicate and translate for us as well.
Yeah, and something else is important to know as well, knowing people's certain religious customs. So, I know the majority of us are
Yes.
Christians, but there are, any religion can come be in a life and death situation. You have to be aware of somebody's religious preferences when it comes to their care.
Yes, and more specifically with that, there are a lot of different ethnicities that come through the hospital, especially since we are a state hospital. Sometimes we can have a Hispanic, an Arabic patient, a Hmong patient. We can have somebody, all different ethnicities, and sometimes we do have Jehovah Witness. And you have to know with Jehovah Witness, they do not
I
accept
didn't
any
even
blood
think about that.
products.
Yeah, I
Yeah,
forgot about that. Yeah, that's a great point. So
yeah,
that's why it's important to learn these things. And if you are of any of these faiths, again, you are needed. Being the expert when somebody's life is on the line is so appreciated by our community because at the end of the day, you've got to save whoever walks through the door. And in your case, make sure that pregnancy goes as smooth as possible. Now, before I get to their questions, I think it's important. UMC, like you said, great hands-on, a lot of learning. If anybody's interested in learning things, I know Alan Loving, the volunteer service coordinator at UMC, is always telling people once you turn 16, come apply to be a volunteer. You can shadow some of these people, see what it's like on a day-to-day basis, and really see the results because healthcare is unlike anything else where you get to see tangible results of I had a hand in making sure this person's life was saved. I had a hand in making sure this person's childbirth went as smooth as possible for this family. So I
yeah.
encourage everybody, if you're interested, get involved in things like that. And not only that, you mentioned applying to nursing schools. If you've shown that you have volunteer experience in a healthcare facility, that's going to make you look like an even more attractive candidate in order to be a part of this field.
Yes, and that would be really great. Like I say, UMC does have a lot of opportunities. Even when I was in nursing school, I was able to apply for a tech position on the third postpartum floor. So I was able to get vitals, do finger stick, assess the patients, and it was really great. It was a really great opportunity to be able to be there and learn. And you can also get paid as well if you're in nursing school to help with that. And it also allows you to shadow anyone. You can go shadow, help roll the patients around. There's an extra program, I think it's ambassadors, and they actually come pick up the patients, drop them off at different locations wherever they're needed. They're able to do that. That's really well for them if they wanted to do that. But like I also said, they don't just necessarily have to be in the hospital. They don't want to. There's always like flight nurses, cruise nurse. There are a lot of different activities and different avenues that they don't want to just be stuck in a hospital setting.
Yeah, and I always mention the fact one of my former students at Raymond High School joined the Navy in order to get medical
Yeah.
experience. So she has military training. And then not only was her nursing school paid for, she said nursing school was a breeze because she had that medical training in the military where it was big time hands on, so she can deal with anything from a gunshot wound to a leg getting blown off, but also can do everything else. So anybody you're worried about the college route, the military is a great place to get medical training. Well,
Yes.
I do have some great questions here. I'll get to as many of these as I can. Um, and we talked a little bit about, I like this first one. We talked a little bit about this, but this is Terkala Chambers. She's in 10th grade, one of our volleyball players here. And she asked, what is the craziest high risk situation you've had to deal with when it comes to an OB patient?
The craziest?
Yes.
Ooh. Um, well, we already talked about core prolapse. Um, I think the craziest I've probably seen would probably be a DIC patient. Um, and as somewhat, like I said earlier, some patients can actually go into help and they can go into DIC, and that's more so sometimes they can bleed from every like open orifice on them. So it can be their
Wow.
eyes, their nose, their
Oh
ears, and it's just a
man.
lot because we don't
Golly.
normally see things like that. And then they can bleed from
Ooh.
the IV. So at that point, it's more of a critical situation, and we have to call the more emergent rapid people team to come and assess the patient so they can actually help transfer them to ICU because at that point, if they're not delivered, we can help stabilize them to
Wow.
delivery. And more so would like that to happen postpartum, not when they're pregnant with the baby. Because at
Wow.
that point, if
Oh,
you're pregnant, then we have to do that. Then at that point, you're gonna bleed by the time we try to like get through all those layers of skin to get baby out. So that's more of an
wow.
ICU type situation. But we are kind of considered med surge only because we have a lot of patients dealing with heart failure, kidney problems. It's a lot, and you get to see a lot. We also have a few psych patients here and there, and we also have a few prisoners that come in, but they always have a guard escort with them in the room.
Wow. I like this one, and I think Miss Taylor, who just joined us live, will appreciate this question. This is Avery
No,
Harris. She's in 10th grade, one of our volleyball players, also one of our champion archery members. But she asked, "How do you feel about doulas and other support people being present during a birth?"
I actually love doulas. And we also have midwives that we work with at the hospital. So if they're able to help the patient stay calm, help the patient relax in certain situations, I think it's actually really well. It works really well because sometimes our body goes into a more fight or flight response and it kind of makes you tense up and kind of constrict everything. But whenever your body's able to relax, I love getting my patients out of bed. I love birthing balls. I just love being there for them. If you don't want a medicated delivery, that's fine. We can go the all natural route. We have heated packs, and I'm there. I'm here for it. I love it.
Love it. Now here's somebody you might know. This is Tanaya Willis, uh, ninth grade, and has told everybody all week that her cousin is speaking to us today. But she asked, "What is one thing you wish you knew before you became a nurse?"
Hmm, that's a good question. Um, I don't know. I think everything I've learned this far has made me the person I am. So I don't really know how to answer that.
Well, it's definitely something, and I think we can all agree you can do great in nursing school, but nothing's going to teach you like the hands-on stuff. You got to be ready for anything. I
Mhm.
got time for two more. This is Joshua Williamson, one of our football and baseball players here, and he asked, "When you were delivering a child and you were not used to it, did you ever feel like fainting?"
No, surprisingly, no. Um, Not even in the C-section room when you're seeing everything. Look, you're gonna have, there are cases where people do pass out. It's okay. We just catch them, just slide them down safely so they don't hit anything. It's fine. I didn't get weirded out or lightheaded or faint when seeing anything. I don't know. It just depends. Like we need. I don't think you can. It's more so your field. If you more so feel faint every time you see blood or see, like if they were to do a C-section, you're able to see their uterus. You're able sometimes if they're throwing up, you kind of see their intestines kind of come out. It happens. If you pass out, it's okay. We're gonna give you fluids and then we're gonna take you out of the OR. That's just what we do. It's fine.
Wow. Oh, that's what I'm saying. You got to know what you're getting into because I definitely couldn't do it.
Yes.
Now this one is Caitlin Beal, sister of our friend Kyron Jobe, who you remember, great basketball player here at Velma Jackson. She wants to be a nurse, so she's got some pretty in-depth questions here. And she asked, it's got a two-part question. She asked, "What's one moment in your career that changed how you see your career, and what did it teach you?"
Ooh, that was gonna make you think there. Okay. Um, that changed my career. Hmm. Okay. Um, I'm not really sure. Like I mentioned earlier, we do have midwives, and I guess having them and being there with them, because you have more of the standardized hospital setting and you have policies and protocols that you have to follow. But being able to actually work with the midwives has changed my aspect that not everything just has to be more so like robotic, and being able to be with them and see the actual experience of a natural unmedicated birth. I guess that more so aspect is like, okay, I can actually do this way. I don't just have to be more AI robotic and just do go through it with the motions. I'm actually able to be there, be one-on-one with the patient, actually help them, teach them, and actually show them ways to actually help them open up their cervix more and be there with them. Like I said, with the doulas and everything else, that aspect of having them actually present at the delivery showed me that I can be more hands on and be more of an advocate with my patient.
Love it. Now she has a second question, and she's getting medical here. I like this. She asked, "What is the hardest skill to learn when you're delivering a baby and it's in the breech position?"
I can't say we do ultrasound all of our patients before we do anything, and more so with our hospital, we don't deliver breech babies.
Oh, I
We
didn't know
can
that.
either we do not do deliver breech babies. We can do a C-section or we can do an aversion, and that's where we go to the OR and kind of set up for a C-section, but it's not. And that's when the actual doctors get the ultrasound and try to turn baby head so the baby can be actually head down, cephalic, and we can do that.
You got a great reaction on that one. So now we're almost out of time, and we thank you so much for joining us. But a couple things before we go. First, why
Okay.
you've talked about all the realities of the healthcare field, but and some of it's gross. I mean, there's no doubt about it. But why is there such a need for great, talented kids to get into this field?
Like I said, there's just so much that you can do. Um, so many different avenues. Like I said, you don't even just have to necessarily be in the hospital, but there's just a need for more people to be involved to help because we're always going to need nurses. We're always going to need somebody to help take care of somebody when they're sick, regardless if they're sick or not, or delivering. Whatever avenue you decide to choose, there's always going to be a need for nurses.
Love it. Now, the last thing, and I speak for so many people when I say we are so proud to call you an alum. It's just amazing the things you've been able to do. But at the end of the day, even if kids are not interested in getting into the health field, you are walking these same halls, growing up in this same community with a lot of these same teachers, then you became extremely successful. So obviously, it can be done. So
Yes.
as these kids are starting to transition through Velma Jackson, or wherever they are, what do they need to do to be successful, just like someone like you?
For them to be successful, they will have to stick, they're going to have to set a plan for themselves. Where do they see themselves as far as short term goals, long term goals, and actually have to create a daily plan and discipline themselves. They're going to have to discipline themselves and say, okay, I have to do this, I have to do that, and set a time limit for themselves so they actually can study and set aside time to actually, okay, I've done this for this amount of hours. It's okay to take breaks. Take breaks. Still live your life. It's okay. You can go take a break, travel, do this or do that, but always come back and know that what your end goal is.
Love it. Well, we appreciate you so much joining us on your day off. I cannot tell you how long I've wanted to have you on this platform, but again, it's just amazing seeing what all you do and continue to do. But again, my girl, class of 2018, Velma Jackson, member of the Velma Jackson Hall of Fame, Myia Bacon. Thank you so much for joining us today.
All right, no problem. Thank you for having me.
All right, talk to you soon.